Mhm.
Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armin Budish, and from the Board of Health, we have Health Commissioner Dr. Rod Harris, Medical Director Dr. Prakash Ganesh, and Director of Epidemiology, Surveillance, and Informatics, Jana Rush. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Hey, happy to be here today with new Cuyahoga County Board of Health Commissioner, Dr. Rod Harris. Dr. Harris, thanks for taking the time out to join us. I look forward to hearing your... Oh, it's great. Look forward to hearing your thoughts on the status of the pandemic and look forward to continuing our work with you in the future. We also welcome today the Board of Health's new Medical Director, Dr. Prakash Ganesh. Thank you both for joining us today. Unfortunately, just when we start to relax, the virus comes back. COVID-19 is on the rise again in Cuyahoga County. According to the CDC, the community level of COVID in Cuyahoga County is up to medium based on cases and hospitalizations. Cases have increased by 76% in the last 2 weeks, with an average of 424 cases per day. While the 2 variant is more contagious than other variants, it's not as severe as past variants in general. But you could still get sick, even very sick. And the scariest part of getting COVID isn't just getting tired with cold-like symptoms and missing a few days of work. Long COVID is real, and it's affecting up to 30% of people that were infected with the virus. That's according to the American Medical Association. Long COVID is defined as 4 weeks or more of symptoms, like shortness of breath, fatigue, hearing problems, or dizziness. These long-term symptoms can be debilitating. Your best protection is to get vaccinated and boosted. They work, even against the new variant. You can get your second booster if you're immunocompromised, age 65 or older, or are age 50 or older with underlying medical conditions. Vaccines are widely available. Make an appointment with your doctor or just about any large pharmacy. Please get vaccinated. Now, before I turn it over to our new health commissioner, I want to talk about another topic that's been big in conversation lately, and that's the baby formula shortage. For months now, parents and caregivers across the country have struggled to find baby formula due to product recalls by major formula manufacturer Abbott. I know this has been very hard for families in Cuyahoga County. Very, very tough. Luckily, it appears that formula will be hitting shelves this week after President Biden invoked the National Production Act to boost production of formula and authorize the Defense Department to help fly formula in from overseas. Abbott's plant in Michigan will reopen the first week of June after reaching an agreement with the FDA last week. All that means everyone should start seeing more formula at stores very soon, if you haven't already. But if you don't see the formula yet on the shelves, I want to tell you about some of the resources available to parents and caregivers. The Federal Health and Human Services website has a great web page laying out all of the potential methods for finding formula near you. It's a lot easier than going store to store to store to store. Here are some of the options. You can call United Way's 211 line, which could connect you to a specialist that may be able to help you find food locations that have formula. You could contact your nearest WIC office, that's WIC, which is operated by Metro Health here in Cuyahoga County, to identify additional sources of infant formula nearby. You could also call a formula's manufacturer hotline to make an urgent product request. One of these resources should help you get the formula you need for your baby. Now, the website with this information is on your screen, www.hhs.gov/formula www.census.gov/index.html. Thank you. And with that, I'll turn it over to Health Commissioner.
Thank you. I hope that our internet signal is working very well here, and if not, then I hope it catches up very quickly. Again, my name is Rod Harris. I'm the new Health Commissioner for Cuyahoga County Board of Health, and I want to spend a few minutes to talk about what medium really means, and I hope you understand how the CDC comes up with these ratings. So it's 3 indicators that lead us to this medium rating. One will be what the hospital admissions are related to COVID. The second is how many hospital beds are actually devoted to COVID patients. And then third, we have the number of new cases that are reported. And Jana, who will go into more about the numbers, will tell you that it's very underreported, the number of COVID cases that are new, because so many of us are doing home tests in the privacy of our homes or our workplaces. But I would also like to add that the community level did change just over a week ago. And primarily that is due to new COVID cases that are being reported. It is up 28% from the previous week. And we're happy to say that the deaths and also the hospitalizations are still low at this time. And Jana will give you more specifics regarding those numbers. Regardless, the recommendations are still the same. We still want people to test if you're feeling sick. If you have any symptoms at all, please get tested. And then also, if you are going to a congregate setting and you're going to be around others, it doesn't hurt for individuals to get tested as well to make sure that everyone is being safe. Second, stay up to date on your vaccines. If you are eligible for a booster, definitely get your boosters. This is one way of definitely making sure that we're striving back to getting a low rating for our community level. And I will say for medium level, there is one additional recommendation, and that's for those individuals that are at high risk for catching severe illnesses from or symptoms or anything from COVID. And those are individuals who are older. Those are also those of us who are with immunocompromised systems and also pre-existing conditions that might be complicating our medical status. And then lastly, as I close out and turn it over to Jana, I will say that we have tons of tools, and we'll discuss those today. We have clinical interventions that Dr. Ganesh will talk about, and we also have non-clinical interventions that Jana will speak about. But we have these resources available, and there is hope that we can get back down to a low community level if we all do our part to make sure that we keep ourselves safe and those around us. And so next, we'll bring up Jana, who's our director for Epi and Surveillance.
Okay, good afternoon. I know we're going to wait to have the dashboard uploaded on the screen. Okay, so for the week ending of May 21st, cases have continued to rise in Cuyahoga County. We're marked by ranking 6th in the state of Ohio per capita for cases. While about 20% of Ohio counties are currently experiencing a medium level of COVID-19, including Cuyahoga County, a few counties in the state have moved into high levels. Based on our COVID-19 community level of transmission moving to medium, residents should continue to take prevention measures to prevent the spread of COVID-19, including getting vaccinated and boosted, considering testing before attending large in-person gatherings, and masking indoors. A recent study released by the CDC showed that wearing a mask lowered the risk of testing positive for COVID-19 by 56% for those that are wearing a cloth mask, 66% for those that are wearing a surgical mask, and 83% for those that are wearing a KN95 or N95 mask. Protecting yourself and your community for COVID-19 is still very important. We know that 1 in 5 people who are diagnosed with COVID-19 report health conditions related to the heart, lung, kidneys, or brain that may carry on 30 days or more after surviving COVID-19. Okay, so on to our dashboard. So here we have our overall case numbers that are being reported. So currently in our Cuyahoga County jurisdiction specifically, we are averaging 300 cases per day, which is 5 times higher than our baseline, which is 50 cases per day. We remained at baseline through the end of March before our numbers began to increase. Our case rate is 382 cases per 100,000 residents, which is 40% higher than what we're seeing across the state of Ohio overall. Over 196,000 cases have been reported to date, as you can see listed here on the left-hand corner of the dashboard. Our hospitalizations were at about 3% for inpatient beds are in use by patients with confirmed COVID-19. And as you can see at the bottom left-hand corner of the dashboard, you can see that over 7,700 hospitalizations have been reported to date in the Cuyahoga County jurisdiction. So less than 5 deaths. So we're happy to report that less than 5 deaths per week have occurred over the past 2 months. This is a huge decline from what we were seeing during the Omicron surge and even more during the Delta surge. And over 3,800 deaths have been reported to date in Cuyahoga County overall. So these numbers will be updated on the dashboard to reflect that on Friday by 2 p.m. As we move into the next phase of the pandemic, we're paying closer attention to monitoring clusters and outbreaks within the community. So as of May 3rd, a total of 157 active clusters are currently being investigated by the Board of Health. Overall, the active clusters have remained stable with little to no change since the beginning of April. Overall, 65% of those clusters are within congregate settings, and that is specifically and primarily associated with long-term care settings. We had 67 new congregate cases reported. That's been a 50% increase over what we saw from the prior 2 weeks. So congregate cases are showing a slight upward trend. And so we still have to remain vigilant with working with our long-term care communities to ensure that we keep infection rates low amongst that population that is at a higher risk. For vaccinations, we can move on down to the lower half of the dashboard. So as you can see, we're reporting by the trends. You can see the blue line is stating those that vaccination started. The orange bars show those that have completed vaccination, meaning they received 2 doses. And then the green bars are showing those that have received the additional booster dose. So as you can see at the very beginning, when vaccinations were released back in December of 2020, you can see the bar is really going into a influx, and then it tapered off around the summer of 2021. And then we increased back up over November and December when we started to have our spike due to the Omicron surge. So currently 62% of the community has completed their first dose series of the vaccine, and 36% have completed their booster. And so we're starting to slightly increase with our booster doses. As of May of 2022, the Cuyahoga County Board of Health has administered nearly 1,000 vaccinations in the community, and 60% of those were related to for booster doses. And so we did see a slight bump, about 1% of folks overall in the county being boosted at 36%. And so we're still encouraging and pushing that throughout the community. And so if you scroll back up to the top of the screen. So we can click on the View Testing Data tab. So I wanted to give a few highlights or new updates in relation to the dashboard. I think we're still waiting for it to click on the testing section. Okay, so as you can see, we last reported our testing data in April. And so our percent positivity data, we will be sunsetting this information. So this will remain on the dashboard, but it will remain as historical. As we have increased is the number of over-the-counter tests have increased within the population, and the CDC is no longer requiring negative lab tests to be reported from a lot of facilities. We can no longer use this measure as a predictive measure for positivity within the community. And so we'll sunset this information and it'll still be available, but that will be a change to the dashboard going forward. We can scroll down to the bottom half of the dashboard. So the other update that we'll be making, we can click on the map here, click to see map at the bottom. So another change that we will be making to the dashboard is that now that the additional booster is available for those that are immunocompromised or over a certain age, we will be adding data in relation to that second booster dose data. It'll be added here to the map. And as you can see, we still have some zip codes within Cuyahoga County that do have lower rates of vaccination. And those are the communities that we're continuing to work with in order to try to increase those vaccination rates. Another thing that we're tracking, Omicron is still the dominant strand that is circulating throughout the country, as well as Ohio and Cuyahoga County. So we will be tracking all of those variants and subvariants and tracking trends over time. We do not see severe outcomes increasing at this time, which is a positive sign overall. Also want to mention that our flu season is closing out this week. We had a total of six deaths that were reported so far this flu season. That's about 1% in comparison to the total number of COVID-19 deaths that happened this year. And also, lastly, I want to mention that booster doses are now available for those that are 5 and older. And so we're still encouraging the community to please get vaccinated and get boosted, as it is your best way to protect yourself and your family and community members from COVID-19. And so now I will turn it over to Dr. Ganesh to cover more information on COVID-19.
Thank you guys for having me and introducing me, Executive Budish. I'm here to kind of present what I've been seeing in the clinic, in my clinical practice, along with my patients, what I've discussed with them, and then also what I'm seeing at the Cuyahoga County level as well. Most of the patients, as has been alluded to, are being diagnosed through home tests that we're seeing. Many that are presenting in my clinic are symptomatic, and many are not vaccinated, but we are seeing a large number of people who are vaccinated coming in with new onset of disease. But I do hear people always saying, you know, COVID is not as severe as it used to be. Do I really need to be taking a lot of these precautions, like kids in school as well? So for some, that may be true, but for the most vulnerable in our community, that may not be. So to reduce our risk for undue consequences from passing it on to others, such as children or elderly, those with immunocompromising conditions, we want to reduce that risk. So as has been stated before by my colleagues, masking, vaccination, socially distancing. I unfortunately see people who are seeking care and or vaccinations only when loved ones are sick, and that could vary on how severe it is, which is hard to see for something that could have been prevented. In addition, we are seeing more and more cases of long COVID, so symptoms that are ongoing past 4 weeks. And a lot of times, a lot of newer data is showing that people with long COVID are not those that have a lot of comorbidities or pre-existing conditions. And they are often not hospitalized, so they're not people who've had severe disease. As Ms. Rush alluded to, there are many, most of the variants right now is Omicron. We are seeing that it is spreading pretty easily, but vaccination does provide good protection. However, we are seeing that natural immunity, so people who are infected, may not have the same protection as a vaccine would provide. So it is still important to vaccinate. And then I just want to make sure, like, we want to do our best to protect our community, those around us, ourselves. So make sure you stay up to date on vaccinations, continue to mask, socially distance, wash your hands. And that's the best way to protect our families and our community and the most vulnerable. So if you do think you are sick, make sure you test early. There are home tests that are available, and the federal government has allotted 8 more tests per household as well. And especially during the season where we're concerned about allergies, if you are feeling those symptoms, try to test before you go out into public or gather with friends. And then there are therapeutic options that are available that you can discuss with your doctor that you could take early on in disease. There is a website that you could share with your doctor that is provided through, there's a therapeutics locator that you can look up online. So to find the nearest pharmaceutical companies close by to you or pharmacies close by to you that you can get treated by. Thank you. But I'll turn it over to you guys.
All right, thank you all very much for your remarks. We now have a few minutes for some questions. As a reminder, please state your name and media organization when asking a question, and remember to stay muted when not speaking. So we can take a question. Going once, going twice. All right, no problem. Well, thank you all very much for joining today. That concludes this week's briefing. Thank you so much and have a great day.